All right, good evening, everybody. Thank you so much for joining us here for this wonderful town hall to talk about information related to the COVID-19 vaccines. My name is Ken Garcia. I'm with UF Health Communications, and joining us tonight, we have Dr. Michael Lauzardo. He is the Assistant Director for the UF Emerging Pathogens Institute and the Director of UF Health Screen, Test, and Protect. Also joining us is Dr. Kathleen Ryan, Associate Division Chief for Pediatric Infectious Diseases at UF Health, and Paul Myers, the Administrator for the Florida Department of Health in Alachua County. So all three of you, thank you so much for joining us for this evening. Some quick housekeeping for those of you who are on. If you have any questions, please, you'll be able to add those into the Q&A portion here on the Zoom. We will do our best to get to as many questions as we can. When you registered, you likely sent in a question already, and we do have those. So we will do our best again to answer. We can't do all of them, but we will do as many as we can. So with that being said, I'm going to go ahead and turn things over to Dr. Lauzardo for some opening remarks. Dr. Lauzardo.
All right, good evening, everyone. Thank you all very much for joining us this evening for the town hall tonight to talk about vaccines. Just to kind of start out, it seems going to seem kind of strange to say this, but these are really exciting times. And I say it's strange to say this because after the last 15 months of the pandemic and all the challenges that we faced, many businesses having challenges, the lockdown and coming back to work, back to school, trying to get back to normal as much as we could, the need to wear masks, physical distancing, these have all posed challenges. And that's not to speak to those of you who've had loved ones who are very ill, and heaven forbid may have lost some loved ones. The price that society has paid for this is huge, and the price that we're going to pay in the future, I think it's going to take us years to count the cost. But I say it's an exciting time because we're at a crossroads now. We have the ability to get to the point where we can end this pandemic and move forward to get back to normal. The path to normalcy is on its way back. And what the key there, we believe the scientific evidence and medical experience and expertise tells us that the best way there is going to be through the use of the vaccines. When the first talk about vaccines happened way back in April of last year, it seemed like such a far away, distant possibility. How could we possibly get vaccines in time? How could we ever get out of this mess? And then kind of moving forward, we were very, very fortunate. Not only did we get one vaccine, but we've had multiple vaccines become available. The science was solid, the information was good, we've been able to get vaccines, and now that that more than 220 million doses have been administered in the United States of both the Moderna and the Pfizer vaccines, we've really been able to really get a good feel for what these vaccines can really do and what the impact is. When we look at other countries, the handful of countries that are ahead of us in the vaccine effort, looking at Israel, the United Kingdom, and of all places, Chile as well, having had really successful vaccine rollouts, they've had precipitous drops in hospitalizations, in deaths, and also transmission, and they're on the way back to normal. Here in the US, we're also on the way back to normal and actually have had a lot of success with our vaccine rollout. Case numbers amongst those who are most vulnerable have dropped precipitously, hospitalizations are down, and deaths are down as well. But we're not there yet. We're very, very close. And that's what the exciting time is now, is that we're at the point where we're continuing to move forward. Again, forgive me for sort of crude analogy here, but the reality is that we know that as we roll out the vaccines, there's a certain number of people that are not going to get the vaccine no matter what. Either for political reasons or they've weighed the evidence and don't think it's for them, they don't think it's the right thing. There's nothing that we can say that's going to change those people's minds. Their minds are made up. And about 40%, speaking very broad terms here, about 40% are going to get the vaccine. They've weighed the evidence. They're going to do anything they can. And I jokingly say, you can make them swim across a pool of piranhas, and they're going to do that to get their access to the vaccine. But then there's that, what I call the middle 40. And that's the group that's in the middle that really never said no to the vaccine. They've said not yet. And they just wanted to see kind of what the next steps would be. They wanted to weigh some more evidence. They wanted to talk to their doctors. They wanted to see, well, quite frankly, what happened to the people that did get the vaccine and wanted to get, quote unquote, more experience with it. And what we're trying to do here tonight is that I don't think we're trying to convince anybody about the need to get the vaccine. What we want to do is to present information primarily to that, what I call the middle 40, the folks that have been on the fence trying to figure out what to do for themselves, what to do for their kids, what to do in terms of what their role is in the community, what their risks might be, and to address many of these concerns that are there. a lot of these concerns are very legitimate. There are things that we don't know about the vaccines. And to be honest, we've just got to share what we don't know. But we know a whole lot. We know a whole lot about the vaccines now with the rollout. And so tens of millions, hundreds of millions of doses now given, that we do understand quite a bit about it. We also know a lot about COVID. We know what happens when we don't get immunity, when we aren't protected against it. And we also know what happens with, we know what happens with pandemics when they're not controlled and then we just let things continue to flow through. So our purpose here tonight is to really just share information. There's a lot of misinformation, information that's deliberately put out there to sort of stop people from getting vaccinated, to stop us from getting back to normal. And there's also some very legitimate questions that we'll hope to address tonight. Reviewing the questions that were submitted before we started tonight's session, they're great questions. They're very valuable and important questions. And what we want to do is to be able to provide you context and information and steer you to what we think are trusted sources of information. And again, to focus on experts and expertise that is out there to help you make the best decisions for you, for your family, and for the community. So again, there's a lot of questions that are there. We want to make sure that we have a lot of time. But so we're really excited to have this opportunity to start addressing those questions. And our panel here will do our very best to answer all of your questions as quickly as we can. But what I'm going to do now is to turn it over to my colleague and friend, Mr. Paul Myers, who's the administrator of the Alachua County Health Department. He's going to share some figures on the epidemiology of COVID and kind of where we are with the vaccine effort here in Alachua County. So Paul, would you like to go ahead?
Yes, thank you, Dr. Lauzardo, and good evening, everybody. Thank you for having me. It's really exciting that we are at this point, as Dr. Lauzardo stated, at this stage of the pandemic. So what I want to share with everybody tonight is really three main things. It's a very brief presentation. Where are we in terms of the disease? I want to highlight some of our vaccine efforts and then some hospitalization data to really showcase exactly what it is that the vaccination efforts can do to severe disease. So let me go ahead and share my screen. And can everybody see that? Ken, can you see that? Great. Okay. It's not advancing. Here we go. Okay, sorry about that. I've done this enough times you'd think I know how to advance the screen. So where we are in Alachua County, as of today, these are the freshest numbers that I have. We have close to 25,000 confirmed cases in the county. We have tested a lot of people in this county. For a county of 279,000 people, we've tested over 185,000 of them. We crossed the 500,000 test threshold, gosh, a couple weeks ago. And if you'd have told me back when these tests were very sparse and we couldn't get our hands on them, that we would have 500,000 tests done at this time, that's really impressive for a county of our size. Unfortunately, we've had over 1,200 of our county residents hospitalized, and we've lost 275 souls to this disease so far. Over the last 2 weeks, we have processed over 17,000 tests, identified 555 positive cases with a positivity rate a little above 3%. And we have verified 13 deaths. And again, those aren't deaths that have occurred in the last 2 weeks, but actually have been verified, that they've gone through the medical examiner. Most of these deaths occurred several months ago. So in terms of our vaccination efforts, we're closing in on 110,000 individuals in Alachua County vaccinated. We're averaging close to 1,000 vaccines per day. And 40% of all Alachua County residents have at least one vaccine dose. And that 40%, that represents the whole entire population of Alachua County. And we do know that the vaccine eligibility is only for those that are 16 years of age and above. And I have another slide later that shows that actually for everybody who has been vaccinated, who are eligible, the figure is closer to 50%. It actually is at 48%. So here's our case curve from the beginning of the year. You can see the decline. We did have a surge there during the winter, and we expected that. That's what we have coined is the holiday hangover. We had a lot of people indoors interacting. There was a lot of travel, and we did not have a lot of people vaccinated at that point. If you recall, it was in mid-December that the vaccines started to roll out. And so these are very good numbers, very encouraging that our cases have gone down. In terms of our public schools in K through 12, you can see that it really mirrors the county as a whole. Back in January, we had a spike in cases, and since then it has gone down and has plateaued, as has the rest of the cases in the county. Our hospital trending is trending down. This is a very good sign. Again, this is a measure of severe disease in the county. And so again, with the vaccine rollout, and I have a slide here that really correlates the two, the hospitalizations have gone down significantly in Alachua County. Newly hospitalized residents compared to new cases, again, just another way of showing the data, and you can see where we've kind of plateaued right here. And vaccinations by age group. As you recall, we started rolling out the vaccines for those who are most vulnerable to severe outcomes of COVID-19, and those were the individuals 65 years of age and above. And then we were following state guidelines. The governor, in his wisdom, started lowering the age down to 50 and then down to 40. And then, of course, we lowered it down to those who are over the age of 16. And so this is just some numbers for you to take a look at. Number of vaccinated is in blue, and the total population by that age group is in orange. So vaccinations versus daily cases. This is really encouraging and really shows the impact that vaccines have on our daily case count. So again, the vaccine is safe, it's effective, it was developed in a very transparent and robust manner. So we really have a tool here. It's the best tool that we have to get back to normal. And I think that's what we all should be focused on. New cases versus vaccination progress. Now this is by age, so the 16 to 24-year-olds, you can see as the vaccinations go up, the cases go down. New cases, again, in the 25 to 34-year-old age group, vaccines go up, the cases go down. Now again, we have a lot of work to do in this age group, because this is the age group right here, the 25 to 34-year-olds, that our data shows us is spreading the disease in Alachua County. Our median age for the last, I would say the last month or so, has been in this age group. It's not college age students, it's not those in their 40s, 50s, 60s. It is in this age group, the 25 to 34-year-olds. And so if we can get a high percentage of this age group vaccinated, then clearly we can make a big impact in reducing the spread in Alachua County. Here is the case count in the 35 to 44-year-old age group, 45 to 54, and new hospitalizations in terms of our residents for those who are 65 plus. And this is very powerful, because this is the age group that suffers the most severe outcome of COVID-19, those over the age of 65. And you can see the precipitous drop that Dr. Lauzardo was referring to when we start getting vaccine into these individuals. This was our target from the very beginning. We have protected these individuals, as you can see from the data. This is not up for debate. As the vaccines went up, the hospitalizations went down. So we have vaccinated over 83% of the county residents that are over the age of 65, and 48% of Alachua County residents who are eligible to receive a vaccine have received at least one dose. And so again, we have a lot of room, a lot of work to do, and I hope that this town hall that we're having tonight really gives everybody the opportunity to ask questions. You just saw the data that we have published. This is very hard data, and so I really hope that this really underscores the effect that the vaccines have on reducing the hospitalizations and the cases of COVID-19. Just a plug for the way that you can get a vaccine in Alachua County. You know, at last count, I counted over 30 retailers where you could get a vaccine in Alachua County. You can certainly get it through the health department, through UF Health. And so everybody in Alachua County who wants to get vaccinated can get vaccinated. And the best vaccine for you is the one that's available. So get vaccinated as soon as you possibly can. And Ken, with that, I'll turn it back to you.
All right, thank you very much, Paul. So as we mentioned, there's a lot of questions that have already come in through our Q&A. So if you do have questions, please, by all means, put those in the Q&A. In the meantime, we're just going to jump right in and kind of go with a hesitancy type question. A lot of people say that these were rushed. So the Dr. Lauzardo, this is most likely going to be for you, that these vaccines were rushed, that the companies involved have immunity, therefore they push these to go out as fast as they can. How can people trust that these vaccines are safe?
Yeah, so it's important to know, and it's a very important question. And it was one, to be honest with you, when I heard the original plan back in the spring last year that we were going to get vaccines that quickly, I raised an eyebrow and I was like, how are you going to pull that off? But they did. And actually with reviewing the data myself and other people reviewing it, knowing the whole scientific community was reviewing and looking at this, it was done. And this is how we know that it was able to be done. First of all, they didn't skimp on the science at all. So no corners were cut. The exact same process that's used to validate new medicines, new vaccines, and other medical devices, those same what are called clinical trials were implemented. So the same type of rigor, the same side of comparison. So they used tens of thousands of volunteers who were involved in the studies. They were representative of all different sort of ethnic groups and ages from 16 and up, and they were really representative of what was there. And they were independently evaluated, not just by the companies themselves, but they were able to independently evaluate tens of thousands of people in each group. They actually did the vaccine trials where it was a placebo-controlled clinical trial, where they gave a saltwater shot, basically a saline shot, to one group that was the control group and the vaccine to the other, and they compared the outcomes with both in terms of side effects and in terms of impact of the vaccine. So with that, I have a lot of confidence in what was done in terms of the vaccines and no corners being cut. The reason why they also were able to do it so quickly is that we've sort of taken it for granted because we're in the midst of it right now. But this was probably the single greatest scientific effort launched at one time by humanity, focused on one specific problem. And we talk about Pfizer and Moderna and we say, well, they just got those ready. There are hundreds of vaccine candidates that are out there, and there were many that failed. And so there are a lot of different candidates that didn't make it. They didn't pass muster, but these are the ones that performed the best. And there are still other clinical trials that are wrapping up. So we're going to see other vaccines kind of roll out as well that are part of this process. So I think that there's really strong evidence that this worked really well. There were a lot of things in place where the US government also guaranteed that companies wouldn't lose money on these trials, that they would be able to just take the big risk. And some of the companies took the big risk and their plan didn't work. And so the vaccines that worked were the ones that sort of made it to market, so to speak. And now, you know, a couple of 100 million doses in, we've got a really good feel that not only are these vaccines very effective, they're also very safe when compared to other medical devices, other medications, and certainly other vaccines.
All right, Dr. Ryan, we know that for Pfizer, it's for those who are 16 and above, and parents may have received the vaccine, but they may be a bit hesitant for their children. Can you talk a little bit about, you know, the safety, or as far as what teenagers, those 16 and above, could potentially expect, and why parents should consider the vaccine for their children?
So the data that's come out about the vaccines that are approved for the 16 and older is very strong. The immune response of that age group is as good, if not better, than the adults to the vaccine. They experience about the same side effects as the adults in the kind of young adult age group, with the biggest one being sore arm and then some fatigue. Those are the biggest side effects that they get. And they don't have any more serious side effects. And the 16 and above age group, and even the 12 and above age group, is the age group that we do see the multi-syndrome inflammatory condition in kids, where they get this immune storm post-vaccine. So that's the age group we think is really important to get vaccinated, because we don't want to see that kind of thing happening and have long-term health consequences from having had COVID when you have the opportunity to get vaccinated.
And Dr. Ryan, staying with you, kind of staying along that vein, when do we know when those 12 and older will be eligible? How are things going with those trials? And also, do we see it going to younger kids in the future?
So Pfizer has already submitted to the FDA their data on the 12 to 15-year-olds. So that's pending. That went in a couple weeks ago. So we're hoping that within the next month to 6 weeks that might come out. Depends on their review, but that's the data that they presented. Moderna is about ready to submit also their data in that age group, the 12 and up, and studies are starting in the younger age groups. They're going all the way down to 6 months of age. So there's groups that are going to be 6 months to 2 years, and then groups 2 to 5 years, and then groups 6 all the way up to 11. So there's those 3 groups of younger kids that the trials are beginning now, and so we should have information coming out within maybe 6 to 8 months for them.
All right, thank you, Dr. Ryan. Paul, I think this one will be for you. There's been a lot of questions about access. So, Alachua County, it's not just Gainesville, there are some rural areas. So what is being done to help those populations get access to a vaccine?
We have had clinics throughout the county. We have hit just about every municipality in Alachua County and churches in between. In terms of those who are homebound, we have partnered with Alachua County Fire Rescue and Gainesville Fire Rescue to actually go to people's homes that are just, they cannot make it to a clinic. They're very ill. And in terms of access, we've tried to make it as easy as possible. We have opened up phone lines. We have an online system. We have provided slots to various organizations, faith-based communities, and other civic organizations to fill up slots at various locations throughout the county. And then our teams go out and do the vaccinations. Dr. Lauzardo's teams go out and do the vaccinations, whether they're at churches or other locations. And so we think that we have saturated. Certainly, we're still learning as we go. And so we know that there are pockets out there, and we're trying to hit those as best we possibly can. And as Dr. Lauzardo said, now that we're at the 40%, we understand that there are still areas in the county where we can do better. And we're trying to do that every single day and trying to learn different strategies to get to people that can't get to us.
All right, thank you, Paul. Dr. Lauzardo, in the news recently with Johnson & Johnson being paused because of concerns about blood clots, as you can imagine, a lot of people had questions about blood clots. If people do have a history of them, should they still consider getting the vaccine, whether it be Johnson & Johnson, Pfizer, or Moderna, or should they wait?
Yeah, I think for very specific questions like that, I always recommend that people talk it over with their doctor. And so that's a key question for people to have. My recommendation is that if people do have, right now, the official recommendation that there is no pause with regard to using any one of the vaccines based on those medical issues. However, my personal thought is that if you've had an issue with clots in the past, the Moderna and Pfizer vaccines have not been associated with any clots in any way, shape, or form. And so that would be my recommendation there. In terms of what was found with the Johnson & Johnson, just for a little bit of background for everybody, the Johnson & Johnson vaccine was paused several weeks ago when it was identified that 6 people out of about almost 7 million doses had developed clots in their venous system or in their blood system, usually at the base of the brain, the cerebral vascular system towards the base of the brain. This is a very serious issue, so obviously that required more follow-up. The system worked. In other words, it found a very, very rare potential side effect and then evaluated it more to see were there more of these that were out there, more cases that were sort of happening that we weren't aware of, and they found only 1 more. So you're talking about something that had an incidence of 1 out of a million. It's still not clear if it's related directly to the vaccine, but I think it's a very good sort of example of the safety measures that are in place even after the clinical trials. So a lot of people say, I don't want to take this vaccine because it's an experimental vaccine. It really isn't an experimental vaccine. In other words, it's new, but that's not the same as experimental. Experimental is when you sign up for a clinical trial and we don't know what's going to happen with the vaccine. Those were those brave souls and those kind of helpful people that really signed up for those clinical trials early on. And they were the ones that kind of found, that these vaccines worked. They're not experimental in the sense that we've now given it to over 200 million people in terms of the Pfizer Moderna doses, and we've got a really good feel for what potential complications could be there. Johnson & Johnson was released back once again, and so now it's back on the market with some warnings, and particularly with younger women, particularly those who may have had problems with blood clots in the past, should probably not get the Johnson & Johnson vaccine and talk it over with their doctor. But again, with so much Moderna and so much Pfizer vaccine available, if there's any question, I would recommend just going with the Pfizer and Moderna, which has not been associated with those side effects.
Dr. Ryan, you hear a lot in the news, people say young people don't seem to be as susceptible, especially children. You kind of touched on some reasons why parents should consider it. So one parent says, is it still necessary to vaccinate them if they are not considered a high risk for getting the virus?
So I think it's important to vaccinate them even if they're not at high risk to get serious disease, because some of them do. Not very high percentage, but some kids do get more serious disease. And if they have underlying health conditions, they're more likely to get serious disease. Plus, when you think about the whole community, you want to help the children protect their family from getting the disease. They don't want to give it to their grandmother who's 80 and has bad heart disease, or to their sibling who's undergoing treatment for leukemia. So it's kind of in that realm. We don't want them to get it, even though they might not get a very serious disease, but we also want to help them protect the rest of the community. And since there so far seems to be very little risk with getting the vaccine, I think the idea that we're all in this together and we want to protect each other is a really important way to think about it.
And a question that came in, this is going to be for you as well, Dr. Ryan. What advice do you have for parents who may want to consider sending their kids to summer camp, summer travel, doing activities with other kids who have not been vaccinated?
So if they're in the age group that can get vaccinated, then the safest thing to do is to go ahead and get them vaccinated. The CDC just came out this week saying that fully vaccinated individuals can now go outside and participate in activities without masks. So the safest thing to do if they're eligible is to get vaccinated. If they're not eligible to get vaccinated yet, if the vaccine is not available for their age group, then most summer camps and activities are going to still do masking and physical distancing in order to try to stop the spread, or at least lessen the spread of the virus.
All right, thank you. Paul and Dr. Lauzardo, I think this one might be for both of you to share. But for Paul, are we seeing variants in our area? You hear a lot about the variants. And then Dr. Lauzardo, what do we know about the vaccines that are available and their efficacy against these variants that we've heard about in the state of Florida?
So as of today, we have identified 76 variants in Alachua County. Most of them are the United Kingdom variant, a few West Coast variants, and a handful of Brazilian variants. And I know that there's a lot of sequencing being done, especially at the University of Florida, but I'll let Dr. Lauzardo chime in on this one.
Yeah, so the variants are an important thing to keep track of. In other words, so what the variants are is it means that as any infectious disease, in this case, obviously the coronavirus, evolves over time, there are mutants. They change, the virus changes, and those mutants may or may not make anything any different. Sometimes they do, or they maybe become more infectious and maybe actually more dangerous. But still with COVID, we're still trying to understand that. There is some evidence that some of the mutants that have arisen, as Mr. Myers kind of pointed out, that are variants that are what are called variants of concern, that we just know that they can potentially cause more problems. However, let's look at real world data. Right now, the studies that are out there show that the vaccines, Moderna and Pfizer specifically, where the most data exists, are still very effective against the variants. And what's most important is that what really matters with regard to the vaccines. When we talk about vaccines effectiveness, we think about, do you get COVID after you get the shot? But the ones that really matter are really in terms of the big things or the big outcomes. Do you get so sick that you have to go to the hospital? Do you die when you get this infection? And there, the vaccines are near perfect in terms of how they protect people, even against the variants. So the variants are something we need to continue to watch. That sequencing that Mr. Myers referred to is how we get the virus, look at the genetic material, and then really identify whether or not mutants are emerging or starting to develop in our community or were brought here from somewhere else. But we're not seeing that in huge numbers. But what we are seeing is that the vaccines are effective. And then kind of getting back to the countries of origin where these vaccines had started, with Britain, with the UK B117, South Africa had another variant that came through, Brazil there as well. But in those places where an effective vaccination campaign has been put in place, the numbers still drop whether or not there's variants there or not. Again, variants are important. We need to monitor them. We need to continue to mask when we're not with vaccinated individuals. And there are things that we just need to kind of continue to do to control until we get a better feel for this. But the reality is that vaccines work. Keep pressing on with the vaccines. The news is good. Continue to press on until we know more of whether or not the variants are going to be able to escape from the vaccines. But right now, it looks like the vaccines are exceptionally helpful, even against the strains that are the variants or the mutants, are those variants of concern.
And staying along with those variants, you're starting to hear a lot about boosters. So when do you think we're going to have to be using boosters? A lot of people are asking about that.
Yeah. So the science on that is evolving as we go along. So just a little bit of background. And again, I've been accused of being wordy at a time or two, so just bear with me here. So just to kind of give a little background. So an important thing to remember about the reason why people were thinking, oh, boosters are definitely going to need to happen, because before coronavirus, there were 4 other human coronaviruses that caused, pretty mild respiratory illnesses, the common cold. And we don't really develop great immunity against those. So in other words, you can get reinfected fairly frequently from that. So the thought was, oh, this is another coronavirus. We're not going to be able to mount a good immune response. It's going to be long lasting. So the idea is that we were preconditioned to think that, and with good reason, right? That was our experience of this class and this family. But the reality is that we found that reinfection is not as common as what we thought, but it is even less common after getting vaccinated. So in other words, once you get vaccinated, there's a lot of protection that's there. It's not 100%, but it's very, very effective. So the thought is that the immunity, especially that which comes after vaccination, which appears from a lot of laboratory tests and some real world data now that it's better than what you get from natural infection, more longer lasting, it looks like it's going to last. The first data that was released from the beginning of the Pfizer study that looked at 6 months post-vaccination, how good is it really, showed that really there was no loss in effectiveness of the Pfizer vaccine 6 months rolling into the trial. So I've heard a lot of misinformation that's out there and misunderstandings that say, oh, why am I going to get the vaccine if I just got to get a booster in 3 months and it's not going to work? The reality is that it's going to work probably for at least a year. And now there's other data that's coming out from the laboratory looking at the immune response in the lab, looking at not just the antibody response, but also the T cell response. That's another part of the immunity that's very, very important in fighting viral infections. That T cell response looks like it's quite long lasting, very long lasting. So we've got to wait for more data to come out. We don't know exactly, so I can't give you a straight answer to say, oh, it's going to be in 18 months, you got to get your booster shot. We don't really know just yet, but it may be as soon as a year, but could be longer or may not even be necessary. So again, stay tuned. We've just got to get more information about that, but don't let the fact that a booster might be necessary in the future stop you from getting the series incomplete, because it may very well be that a booster may not be needed for 2 or 3 years. And as a final point, remember that we're going for herd immunity, not just to protect ourselves as individuals, but to protect the community. We have the opportunity that when we get to herd immunity, and why that's the sort of the holy grail of this vaccination effort, is that once you get to that point, there are so many dead ends to the virus, it can't spread. And when it can't spread, it stops. The pandemic is done. So that's the goal, is that we just kind of move on. The virus might circulate in small groups, but it will not do what it's doing now.
Dr. Ryan, back to you. Some parents are asking about like what kind of things their children might experience when they get the vaccine, and kind of along that, perhaps a 16-year-old who probably looks more like they're 12. Maybe they haven't grown to be what a 16-year-old people would think. What do you say to parents who have those questions? You're still on mute, Dr. Ryan.
The side effects of the vaccine, from what we know, in the 16 and above, and then in even what was presented to the FDA from Pfizer for the 12 to 15-year-olds, indicates that the side effects are mild. Mostly it's arm soreness, which most adults get too, some fatigue, maybe some headache, maybe they get a little bit of muscle aches, but nothing serious and very short-lived, usually 24 hours at the most of symptoms. It seems like the middle-aged group of individuals who get vaccinated have slightly more significant side effects from the vaccine, but the older and the younger seem to have little side effects with the vaccine that don't last very long. As far as someone who's 16, but more the size of a 12-year-old, I wouldn't use that as the basis to not vaccinate that child, because there's even though they're small in stature, I'm not very big in stature, they can still, they're still from a maturity standpoint, they're still 16 years of age. So size doesn't matter. I would go ahead and, unless they have underlying health conditions that they're also concerned about, I would go ahead and vaccinate that child.
And Paul, this one's kind of a question about age. So for example, someone is 15 now, but they're going to be 16 in maybe 2 or 3 months. Are they able to get it now, or do they have to wait until they're officially 16?
They have to wait until they're 16.
Short and sweet. Perfect. All right. And kind of talking about the side effects, Dr. Lauzardo, some people are talking about how they received either the first vaccine dose or have received both, and they have not felt any side effects. Are they concerned that the vaccine may not have worked because everyone else may have experienced it, but they didn't? So they're concerned that they don't have the immunity, or at least the antibodies like others might.
Yeah, that's a logical conclusion, but we're all different. So we all have different responses. And so it's really something that's really not going to show that it didn't work and that it didn't take, nor does it mean that you have a more severe reaction that somehow you're going to be even more protected. So we really don't know why people have the different responses. It has to do with a lot of different factors that vary throughout the course of the day that you get vaccinated, a lot of different things that kind of go on. So it's hard to give a really good answer, but no, the vaccine probably worked just fine.
And kind of along that, you're seeing this in the news. Some people are getting their first dose and they are worried about getting that second dose because of the potential for side effects, and they're skipping the second one. So are they good with one, or do they need to get that second?
They need to get the second dose. So in other words, and there's kind of an urban myth of how bad the second reaction is. For some people it is worse, but those are the people that kind of get the word out. So for most people, it's very similar to the first time, maybe slightly worse than before, but it's not a reason to not get the vaccine. So I would certainly say that they do that. There was another question that kind of came through there that, can you be a little bit late? And that's a different question. So if you're a couple weeks late, that's perfectly fine. There's no reason to think that you can. If you're like 1 week, 2 weeks, 3 weeks late, that's not a reason to say, oh, I didn't get it on my exact date. I'm going to skip all the way and go and just not do it at all. You can be up to a month late, and there's no reason to think that there will be any problems with building the right immunity. And actually, there are ongoing studies, primarily in England, that are looking at different sort of schedules and kind of looking at different ways in which the vaccine can be administered. But just get the second dose, and it's okay if you're a little bit late.
And Dr. Ryan, there's a question asking about pregnant women. Are they able to get it if they're in their first trimester? And also, can lactating women receive the vaccine?
So the CDC is stating now that we don't have a tremendous amount of data in pregnant women. They weren't included in the trials that were done, but from what we know about the vaccines and pregnancy, they are recommending that pregnant women in any trimester go ahead and get vaccinated with the COVID vaccine. From all the women that have been done, there have been no effects on the pregnancy, and there have been any effects on the fetuses, the babies. So, and along the same lines, with lactating women, the vaccine doesn't appear to transmit into the breast milk. So there wouldn't be anything from the vaccine in breast milk. But if a woman becomes immune and she's breastfeeding, she can pass that immunity on to the young infant, and that may be protective for the young infant, as with other vaccines and pregnant and lactating women. So that is the recommendation. They say it is a personal choice if you choose to get vaccinated when you're pregnant and lactating, but that the CDC is recommending that women do that.
All right, thank you, Dr. Ryan. Dr. Lauzardo, there are a lot of questions coming in about pre-existing conditions, perhaps having anything from heart disease, kidney failure, immunocompromised. Is there anything that someone may have that's a pre-existing condition that would prevent them from getting a vaccine?
Yeah, there's two minor things. What I would say is that the first one is going to be if you've ever had, if for your first dose, you had a very severe initial reaction, right? And by severe, meaning that it was an allergic reaction, you had to go to the hospital, something unforeseen happened. Those are extremely rare. And I've not seen that. And we've administered more than 50,000 doses through our sites alone here in Alachua County. So that's that's one of the contraindications. And the other one is that if you've gotten another vaccine within the last 2 weeks, and then we would just delay it. It wouldn't be that you wouldn't get it, but you would just get it after that 2-week period of time. Other than that, really, there's no medical condition that would say not to get it. And in fact, we would strongly recommend that people with those conditions that, by chance you just mentioned, those are all people that would be high priority. People with kidney disease, diabetes, heart conditions, lung conditions. Those are the folks that are at greater risk for complications, and we want them to be protected against the coronavirus. So that's the real issue, that we want them to get the vaccine.
If someone has had COVID-19 and they've recovered, do they need to get a vaccine? Dr. Lauzardo.
Yes, they do. And this is the reasoning behind it. So most people think that you do get immunity from after getting infection, and you absolutely do. You get some protection from that. With the studies that are being done now, it looks like that protection is probably not as good as what you get from the vaccine. And there's increasing data to show that the vaccine elicits a much stronger response. Right now, the current guidelines are that if you've had COVID in the past, that you would complete the 2-shot series of Moderna or Pfizer, or get the single dose of Johnson & Johnson. However, there is some debate and there is some uncertainty about whether or not you need to have 2 doses of the vaccine after you've had confirmed infection. And that's the subject of various different studies that are looking at to see if maybe that first infection is kind of like your first shot. And then the second vaccine would be like your booster. And then you don't need to get that sort of second of the Pfizer Moderna, but that's not what we're recommending. But I just wanted to, in the spirit of kind of transparency about what we know and what we don't know, that is an area that's being actively looked at right now to know if you need to get that. But right now I would say if you had COVID, go through the series, because that's the current CDC and Department of Health recommendation.
And Dr. Ryan, we were talking about if there's any pre-existing conditions in adults, is there anything in children that would prevent them, those who are 16 and above, at least at this point, that would prevent them from getting the vaccine, perhaps asthma or something else that they may have?
So along the lines with what Dr. Lauzardo just said, those kids that have underlying pre-existing conditions are going to be the ones that are at higher risk of getting severe COVID. So we really do want those kids to get vaccinated. But I think the important thing is, with any condition that's chronic, that they might be taking medications, that they might be taking IV medications, immune modulating medications, that the important thing is that they should talk to their provider about what their provider thinks about what they should do about vaccine. They shouldn't make that decision without talking to their doctor. Talking to them and having an open and honest conversation about what they should do. And that's the most important thing to do. Most of the time, the provider is going to say, yes, it's just fine that you should do this. But there may be circumstances where they say, no, wait a couple months while we finish this course of therapy, that kind of thing. So that's why it's important that they go and talk to their doctor.
All right, thank you very much, Dr. Ryan. Dr. Lauzardo, after being fully inoculated, what precautions should I continue to do to help keep me and my loved ones safe?
Yeah, great question. So that's something that's evolving. As more people get vaccinated, people who've been vaccinated, all of us in general, will have more sort of freedom to kind of get back to normal. The normal isn't going to be like an automatic switch. It's going to be this gradual process that as the vaccinations take hold and infection rates start to go down, and we should start to see that in a big way here in the next few weeks, as long as people continue to get vaccinated at the rates that they are, we should start to see that. So right now, CDC has recommended that small groups of people who are vaccinated can get together without wearing masks and without socially distancing while indoors. No need to wear masks outdoors as long as you're not crowded. Those are current CDC guidelines, and those are going to continue to be lifted and broadened even more. The question that I think is kind of in there, that's probably a sort of a sister question to that, if you will, is that why would I still need to wear a mask if I've been vaccinated already? And that has to do more with how much COVID is out in the general community. So if you're still having ongoing general transmission in the community, in other words, there's still COVID actively spreading at moderate to high numbers, the fact that you've been vaccinated, you're more protected if you wear the mask, get through the period of time, because you can get a big exposure that can overcome the vaccination. It sounds kind of strange, but if you get a heavy, intense exposure, you can get it at risk. Also, with the spread of variants, that could be an issue. The initial guidance that was given to say that people who've been vaccinated need to continue to wear the mask because we don't know if people who are vaccinated can spread infection. That still holds, but there's now data that's starting to show that people who've been vaccinated not only don't get sick, not only don't get so sick that they go in the hospital and potentially die, they get sick less frequently and they spread a lot less. So there are ongoing studies to prove that point a little bit more and to understand that fully. But that was the other reason why vaccinated people need to wear masks. But bottom line is that we're going to be able to do more and more without masks, without physically distancing, the more people get vaccinated and when the rates start to drop. We're not there yet. And a point to that point, and here's the wordy part of me coming out, so forgive me, is that you keep going until the whistle blows, right? The game isn't over. There's a minute and 30 seconds left in the game. You've got, you're up by 7. You've got to just get the next first down and then the game is over. You'll have enough there, but we're there. That's not the time to just sit on the bench, throw an interception and just quit the game. We're almost there. We've got to continue with the precautions that we're taking and keep getting vaccinated. That'll get us to the finish line and it's back to normal as soon as possible.
I'll open this up to both Dr. Lauzardo and Dr. Ryan. Feel free, whoever wants to answer this one. But when it comes to the vaccine, we know that Pfizer and Moderna are both mRNA vaccines, and Johnson & Johnson, I believe, uses an adenovirus. So people want to know, are these vaccines modifying human genes?
You want to go, Kathleen?
I can take that.
Yeah.
So messenger RNA vaccines, the mRNA vaccines, mRNA is a type of nucleic acid that is in our cells, gets into the cell, but does not get into the nucleus. So in these types of vaccines, we're giving the cells a piece of guidance of genetic material so that they can produce the protein that can then go to the surface of the cell, and then our immune response can respond to that. And that's the spike protein of the virus. So all it's going to do is go into the cell, and the machinery of the cell is going to use that to produce the protein that's then going to allow us to make an immune response. mRNAs don't get anywhere near the nucleus of the cells, so they're not going to be modifying our genetic material.
And the shot just stays in your arm. And so that information, that guidance, that information about how to make the spike protein goes into the muscle in your arm, and those cells produce that spike protein. But think of that mRNA as kind of like a Snapchat message. It comes in, passes along the information, and then it dissolves. It disappears within the cell and is discarded. It doesn't integrate into any type of the genetic material and does absolutely nothing to your your cells themselves. Doesn't affect fertility. And for that reason, it's just kind of stays where it stays put and is very effective for that reason.
And as far as how Johnson & Johnson's vaccine works.
Yeah, so that one is, yeah, you want, no.
No, you go ahead.
Okay, so the adenovirus is an inactivated virus that cannot infect us. It's not the COVID virus. And it basically does the same thing, but instead of just using the genetic material, it sort of hijacks a cell that cannot infect us, but it puts that inside the cell, and then your body attacks it. And in the process of attacking it, it makes your cells produce the spike protein. It fools your body to make the same spike protein, and then that gets destroyed as well by the antibodies that are produced against the spike protein. So when you do get exposed, you kill the virus on the spike protein.
Dr. Ryan, a parent says they're hesitant to vaccinate their 17-year-old. What are the pros and cons?
So I think there's very little cons to getting vaccinated. The vaccines have been shown to be safe. As we just talked about, they don't cause any long-term problems that we know of. There's more and more data. We don't have, 50 years of experience with these vaccines, but the information that we have indicates that there's not going to be any long-term side effects from these vaccines, and they're very effective. I mean, they're very effective in preventing severe disease that can cause mortality. And they also are very effective, but not 100% at cause of protecting from mild disease. So I don't think there's any downside. And the pros are that you're going to be protected from getting COVID, and you're going to be protected from spreading it to other people.
Dr. Lauzardo, a lot of people have heard in the news about these so-called breakthrough cases where somebody has been vaccinated and they still get it. Can you kind of talk about that and help people better understand what that means?
Yeah, so basically it's called breakthrough cases, or what also referred to as vaccine failure. So when the studies were done, to give you an idea, that the first ones were that 15,000 in one group, 15,000 in another. One group got the saline shot I mentioned earlier, the other one got the real vaccine. In the group that got the dummy shot, so basically the placebo saline shot, 100 cases of COVID developed under those conditions, and what was going on in that community at the time. In the other group, there were 5 cases, so a 95% reduction. You still had cases. What was interesting is that nobody died who got the vaccine, very few, if any, severe illnesses in those who got the vaccine. And in the other group that just got the saline shot, you had what we normally see in the epidemiologic conditions. So in other words, as the epidemic's unfolding. So those 5 that have that, those would be breakthrough, right? They've been fully vaccinated, they still get a case. You can't really say that X percentage of people will get it or not, because it depends on how much that group of people are exposed, how much that group of people are exposed to virus at a given time. So if you give the vaccine that doesn't really work, but you put them in Antarctica where there's nobody else with COVID, well, then it's 100% effective because nobody got it, right? So it just depends on what's circulating in the community at any given time. But compared to getting it versus not getting it, that's where that 95% effectiveness, that doesn't mean that 5% of people who get the vaccine get COVID. What it means that compared to those who didn't get COVID, you have a 95% less chance of getting it. So you're comparing a relative amount, not a fixed amount. So it does happen. And what we're doing with the vaccine failures that we identify is that we're sequencing them. We're taking them to the lab to see if there are any variants to find out what had happened. And pretty much every one of the about 12 to 14 vaccine failures that we've identified in Alachua County, it was very mild disease. They had the sniffles. They ended up getting screened. They might have had a little bit of a sore throat. And then they came back positive, and then we went and sequenced them in the labs and really haven't found a whole much of anything at this stage. So it's something that we're looking at closely, but it's something to be expected. And remember that the flu vaccine that many of us get every year, it's a good year if it's 60% effective. We're pretty happy with 50% effective. This is 95% effective with both Moderna and COVID and Moderna and the Pfizer vaccine. So again, very helpful and very effective vaccines.
Okay, we are coming up here almost to the top of the hour, so I think we should be able to get in at least one more question before we have to say goodbye. So one of the questions is someone, if they're going to be traveling, whether it's internationally, if they are able to, or even across the country, what can they do to protect themselves from the variants? And they have been vaccinated.
Yeah, so I'll go ahead and jump in on that one. So the vaccinations are going to protect you against the variants and others. If you're concerned while traveling, I mean, just continue to use the same precautions that you've used before you went traveling. Again, now also know that not domestically, but internationally, requirements for vaccines are probably going to be imposed by other countries. So you're going to be traveling mostly internationally with other vaccinated individuals at some point, depending on where you go and when you go. That'll certainly be true of Americans traveling to, say, Europe later this summer. But in terms of the things that you can do is wash your hands, but most importantly, wear a mask. If you're going to be in an enclosed space like a cross-country flight and you really want to be careful, you can wear an N95 mask. I think that's excessive for someone who's been vaccinated and is going to be traveling. A surgical mask may be sufficient, but the full-on protection would be to do both of those, N95 plus that. And then the usual precautions. But otherwise, again, I don't want to overstate the protection from the vaccines, but the vaccines are very effective and will allow us to do a lot of things to get back to normal. And also know that nationally, we're approaching the 50% mark of people getting over 40%, approaching 50% of Americans having been vaccinated as well. So that viral load in the country keeps dropping, it's going to make it easier and easier for us to do things safely.
I was wrong. We're gonna do one more question for you, Dr. Ryan. Inside the vaccine, are there eggs or anything beef protein? And with that in mind, what activities can families do together once vaccinated?
Well, families in general, you know, if it's the nuclear part of the family, the part that lives together, unless someone gets ill or has COVID vaccine, they can not wear masks and they can do what they want to do together. It's when they're going to be in the larger family portion of the family, or with other groups of individuals that may or may not be vaccinated, that's when they have to be a little bit more careful. So once you're vaccinated, though, you know, now the CDC just put out those recommendations that people that are vaccinated can be around other people that are vaccinated in hopefully small groups. We don't want huge, 50-person family reunions maybe yet without some sort of masking, but smaller groups, you can be on masks. You can be outside without masks, even in slightly larger groups, as long as they, it's not really crowded situations. So that's what I would say to that. And one of the things that I wanted to say is to just give a shout out to the vaccine efforts in our county in particular. You know, what Dr. Lauzardo is doing on campus and what Paul Myers and his group is doing through the health department and all of the vaccine clinics that are available, and how some people still say maybe signing up for it isn't, 100% easy peasy, but once you get on the list and you go to the vaccine site, they're extremely efficient. People get vaccinated very quickly, very easily. There seems to be no problems. I have a friend who was a nurse at UF who's 79 and doesn't travel very much outside, and they as Mr. Myers said, the firefighters just pulled right up to her apartment complex and gave her vaccine. So she was thrilled about that. So, I mean, I think we need to know that within our community, we are doing a great job. It's not like that in every community. And so we need to give a shout out to those people doing all that effort.
And very quickly, inside the vaccine, are there eggs or other type proteins in there for people who may have food allergies?
No, they're not.
Okay.
And if I can just interject really quickly, you don't need an appointment anymore. All of our sites, if you want an appointment, you can certainly make one, but all the sites, even on campus, and Dr. Lauzardo, correct me if I'm wrong, but our health department sites, you can walk up, there's no appointment necessary. The last time I checked in terms of access, there were 30 retail establishments in Alachua County, Hitchcock's, Publix, Winn-Dixie, CVS, Walgreens, and
Walmart.
That doesn't even count the the health department sites and the UF sites. And so everybody in Alachua County, just about who wants a vaccine, can get one.
All right, and Dr. Lauzardo, closing comments.
Yeah, so again, thank you all very much for your time and your fantastic questions. I wish we could get to all of them, and we'll continue to see the interest level and kind of doing more of these to answer more of your questions. Again, just really want to emphasize that this is an exciting time. The news about vaccines has been really good. They work really well. They're very effective. They're very available. As Mr. Myers pointed out, our appointments are all walk-in. Access is not an issue. Walk up. Come to the Champions Club at Bell Hill Griffin Stadium. Watch how the other half watches football games and get your vaccine while you're there as well. So it's a very efficient process. You can come in. We're there Mondays, Wednesdays, and Fridays, giving the Pfizer vaccine. And also just bear in mind that there's a lot of misinformation that's out there. Be careful where you get your information. Don't trust just what we say, but go to other sources that are trusted. Go to the CDC, talk to your doctor about it. The hospitals are not filled with people that are having side effects from the vaccine. They are not filled with people dying from the COVID vaccination. People have not died from getting the COVID vaccination. This is a safe and effective vaccine. That's really our only way to get, or our best and safest way to get immunity. The clinical trials have been done. There's a lot of post-marketing evaluations that have been done to see the safety and efficacy or the effectiveness. And so just really
we were so close. We almost made it to the end before we cut
and then
out.
he froze.
Yeah. Again, thank you so much, Paul and Dr. Ryan, as well as Dr. Lauzardo, who unfortunately is frozen at this time. We appreciate your time this evening answering questions from the community. We're going to continue to provide as much information as we can from UF Health, and I know Alachua County will be doing the same, the health department, and getting that information out. So thank you very much, and thank you to all of you who joined us. We really appreciate you taking some time this evening. This will eventually be posted online, so you're able to watch it and share it with others.